It's important that a woman be able to make decisions about her health based on what's best for her and her family without the interference of politicians, and making sure that she has her health in mind. When policymakers restrict funding on Medicaid, about 1 in 4 women aren't able to get the abortion that they need. We can't know an individual woman's circumstances, so when she's making a decision about her health, it has to be based on what's best for her and her family. Therefore, politicians in Washington shouldn't be interfering with that decision. One woman that we worked with was living in a very rural area. She had moved there with her husband because there was work in the roofing industry. And she called us as soon as she knew that she needed to have an abortion. But they didn't have very much money. Taking time off of work jeopardized their ability to continue in their job. And she lived upwards of 5 hours drive from the nearest abortion provider. Eventually, part of it was paid for by an abortion fund, and she had to sacrifice a lot of her little income for it as well. But if she had had health insurance that covered abortion services, she would have gotten care a lot faster. No matter how we feel about abortion, it's really important that women are able to make their own best decisions about what happens with their health. Federal law unfairly denies women insurance coverage that they would normally have. One thing that people don't really realize is that politicians in Washington right now, because they oppose abortion, are trying to make it unaffordable.